I got done early, so I decided to jump on live now. And I'll wait until somebody joins so I can see if you guys can hear me. We won't be playing those games again. Face is oily. Shit, gonna get my hair washed. Oh, hello. Getting all this oil off my face. Can you hear me? The number one question. Because last time I talked for about 30 minutes and no one could hear me. So good. Can you hear me? Hi. Good. Hey, good. I was on here earlier talking away, just talking. And when I got to my first member's home, I decided to look at the phone real quick and to see what the people were saying. And Lord and behold, the people were saying, we can't hear you. So I use these little sheets to get the oil off my face. So they said nothing should be shiny on your face other than your lips. I'm done working. Take that off. True green. Put some Clinique little lip stuff on. I got a 45-minute ride to my facial appointment in Rochester. I'm so mad because I scheduled it with the wrong company. I wanted to schedule it with Face, and it was one of those Instagram ads, and I guess I clicked on two of them and the wrong one reached out to me and I scheduled with them. This is ruby red jelly that I get from the beauty supply, and I tell you, this is the best lip gloss I've had. This is the only lip gloss I buy for $2. I had MAC, all types of stuff, and it's just the best. So I use that cheap stuff. And then this is like I'm doing a tutorial of my makeup or something. And this is just a little by Clinique. And it's a cute little color for me that I like. It's beautiful. And I don't really wear lipstick. I just wear the lip gloss. And I like it. Look at my lips. They look better when I don't do the little kissy face. I'm just leaving a member house. I'm sitting out here. She probably thinking like, what are you doing? Oh, y'all done came in. Okay, before I take off. Hi, Lily. A1 Photography. Hey. Tony Jensen. Thank you, Lily. How old do you think I am by my profile? I don't know, Lily. I can't look at it. Sung Jin. Hi, you're very beautiful. Morning, please. Hi. Thank you, guys. Thank you. Thank you, thank you, thank you. Nice and juicy. Thank you. Hey. I do see a lot of scams on here. Why am I getting a lot of scams? I don't understand. I don't know. Why? I wonder. That is crazy. What? Are you in Chicago? No. I'm in Michigan. Thank you. Can you say Osmond? What the hell? Somebody asked my bra size. What is this? This is crazy. Somebody said turn the cell phone to the front. Oh, Lord. This is crazy. Anyway. All right, so I'm done with the I guess I won't be putting no personal information on this live. This is weird. Okay. It's just like really crazy. So let me just, this is the first time that, okay, I think they're all off. CJ Apparel. Yes, I can shout out CJ Apparel. Okay, so I think all the spam people have left. Maybe they're coming back. I don't know. Oh yeah, it's still spam on here. They said my nose is so big I probably can smell it. I do got a big nose, but I got a cute profile. See my profile? Okay, so I'm not going to spend time on that. So I'm driving now. So as you guys know,
150 feet, turn right onto
there's no reading comments while I'm driving.
Turn right
so
onto Charbridge Arbor.
I'll read them again when I stop driving. So anyway, like I was saying,
in 800 feet, turn left
earlier, I apologize that you guys could not hear me and I wasted all that time. So now I have to just think about what I said and freaking try not to miss anything. But I talk a lot, so I'm sure I probably won't miss anything. Let me put some lotion on. C by Giorgio Armani. This smells delicious. I have the perfume and stuff too, but I'll just keep that in here. Let me lotion my dry hands before I get on the busy roads. So you guys will start seeing more of me because I'm just going to be more available. I'm going to start dropping videos, pre-recorded videos on Wednesdays. They won't be live. I'll record it and then I'll drop them. So today I was doing my health risk assessments. And as you guys know, I love this job. This is the best. Hold on. This is the best job I've had as a nurse practitioner. I wouldn't, as far as autonomy, so let me backspace delete. When I, like last year, my son's school starts early now. Last year, his school started like 8:50. So I drop him off at school, and then I start my visits. So I start my visits at 10. My availability is for 10 visits a day. So, and I do 10 visits a day because you get cancellations sometimes. So if I get 2 cancellations, I still will see 8 people. And that's truly my goal, is to see 8 people a day.
Turn right onto South
But if I see the 10, that's great. Because I figure 10. So when I worked at the little pain clinic, well, that was horrible, so I'm not even going to speak on that. But anyway, so if I see 8 patients a day, 5 days, then that's 4,000 a week. But if I see the 10, then of course it's more. So I'm comfortable with making the 4,000 a week. Okay. And then, so I set myself at 10 visits. If I was to do the whole 10 visits, I would drop my son off at school, pick him, he used to get out at 4, and then he'll go to aftercare till 6 or whenever I got off. So if I see 10 members a day, then I would get off of work at approximately maybe 4:30, 5 o'clock. 5 o'clock is like the max that I would get off, and then I would get to him and get him from school. So with this job, you can let them know what areas you're willing to work. So I could either work Detroit area if I wanted to, Southfield, but if I work that way, then when I come home, I would always be in traffic. So in order to get my son from school on time, I would have to get out of, I wouldn't be able to see 10 members. I would only be able to see maybe 8 or less, 7 or whatnot, because I would have to ride in that rush hour traffic. So that's south for me. So if I work north, which I prefer to work, or Oakland County, which is south, but it's not too far, it's like 10 minutes from me, then I don't have a problem. Like if I work that way, then I know shortcuts. If I work Oakland County, which is south for me, then I know shortcuts to get home, so I don't have to worry about the traffic. Now, hold on, so if I work north, which I prefer to work, I don't have any traffic, so I can see 10 people and go to my son and don't have to rush get him out of school. So I love it. So I don't miss anything with my son as far as sports or anything. I put him in all the sports. Like starting next week, he'll have golf,
continue straight,
swimming, drawing class, soccer,
continue on Michigan 24
and
south,
flag
18
football.
miles.
What job can you have where you can participate in all of those sports? No job is the answer. You're not about to be working at the hospital or a nursing home, blah, 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 and be able to attend all of those sports, be involved in your child's sports like that. So when I say the autonomy is everything, it's everything. schedule for after 3. Clear my schedule. I'm not gonna for tomorrow or whatever. So with this job, you don't get any penalties or anything for canceling your days, like clearing your schedule. So if next week I'm scheduled Monday through Friday to see members, but I have a last minute vacation plan, like out of the blue, like somebody like, hey, you want to go to Chicago real quick or whatever, Thursday and Friday, I can just call and say, hey, clear my schedule for Thursday and Friday. You don't have to submit no time off and wait for approvals, and you don't have to worry about not being approved, and you know how you request days off months in advance and then they say we couldn't accommodate that. Like, nobody has time for those games. Or, and so now they're saying, or you say, I'm just gonna call in. Like, nobody has time for that. So you just tell them to clear your schedule. Like I said before, this job has so much autonomy where it feels like it's your own business. And like I was saying earlier, it is really your own business because it's a 1099 job. So 1099. Let me know if you guys still can hear me. I guess it's this area that I'm driving is dropping the call. The live. But please, somebody respond and let me know you guys can hear me before I continue. Can you guys hear me? So, can you guys hear me? Can you guys hear me? Yes, good. Thank you. Okay, so what was I saying? Oh, it's a 1099 job. So if you guys know you're going to be reaching out to me like, hey, refer me to your recruiter, I want to get on board, blah blah blah. Or if you're going to be doing any other job that's a 1099, you know, at the end of the year when you file your taxes, you're going to have to pay taxes. So what you need to do, I don't care if you a CNA, I don't care if you not a nurse, you work at a McDonald's, I don't care what you're doing. Go on YouTube if you don't know how to start get a business name, do LLC. If you don't know how to do it, you can go on YouTube. Somebody will say, follow along with me, let's apply for a business name together. It's that simple. It doesn't cost anything to get an EIN number, so just get it. You can do that today or whatever. But you do want to have a 1099, you do want to have a business name, so at the end of the year with your taxes, so doing this is a business. So I'm a contractor, so therefore I can write things off. I can write off gas at home. When I'm at home, I'm getting my paperwork together, making calls to the members, to the employer. So you can utilities, food, you go to the restaurant, you can write all that up. Vacations, you know, if you're going on vacation, you talking to people about the job or whatever you doing, you can claim vacations. It's all types of stuff, and you can YouTube things that you can write off on a 1099 with a 1099 job. So if you don't want to pay those heavy taxes, is there still a lot of trolls on here or no? I don't think so. Okay, so you guys know how transparent I am. So it's the beginning of September, and I've already made $92,000 $92,000 already. So, and the year's not over. Got September, October, November, December, 4 more months to rack up coins. So, my taxes is going to be a lot if I didn't have a business and I'm able to write off, do a Schedule C, and my tax lady, you don't have to do all this stuff. Your tax person, your tax preparer will do this for you. And if you got a good tax person, you're gonna pay little to nothing, or you might even get a refund back. Depends on your tax person. So that's that. 1099 jobs, you gotta have a business name to write stuff off, or you're gonna be paying a lot of taxes at the end of the year. So that's that. So what else I want to talk about? So as far as my pay, so you might have some RNs in here like, girl, I made 92 already too. I made more than that. Okay, that's fine, because you can make what I'm making as an RN, with all these contracts or overtime. So what you have to realize is I'm not putting in no overtime. I'm not away from my family in a different state to collect the coins. So yeah, as an RN, you can hustle and bustle, and I give you all the respect. But some RNs or whatever like to get smart or whatever, like, oh, you make that as a nurse practitioner, I make that as an RN. But how hard are you working? How hard are you working to make what I make? How much are you neglecting your family to make what I make? Is the question. So if you don't want to neglect your family, if you don't want to, have nobody over your head telling you when you can take off, when you can go to break, when you can do this, when they need you back to the floor, having people calling you to come back to the floor, all that crazy stuff. If that's what you want to do for your life, then that's fine. I just don't want to do that. I don't need nobody telling me, Angela, let me talk to you in my office, and trying to talk to me like, I'm a little kid. That's why I've never had a desire to work at a hospital. I had to work at the nursing home to work my way up and get my experience or whatnot. But I knew my end goal was not to work at nothing like that. So if I've always done home care and took care of one lady after the nursing homes and things like that. As an RN, at the end of my LPN to RN to nurse practitioner, I've worked with one lady, took care of her at her home, and she's now my son's grandma. But I refuse to work, and I used to get in trouble too, because they used to try to talk to me, and I used to check them like, who do you think you're talking to? I told you to do this and you didn't do it fast enough. And I used to be like, why did I have to do it fast? Explain that to me. Oh, because I told you to. Well, that's not going to work with me, honey. Because y'all let these positions go to y'all head and think y'all higher than mightier than all, and forget that at the end of the day, we're all adults, honey. Talk to me with some respect. So I couldn't work for nobody because my mouth, I wasn't reckless, I wasn't ghetto, but I know how to, slice and dice somebody in a professional way. Like, you're not going to talk to me any kind of way. So I just knew that I have to have my own business, and this is the closest thing to having my own business. So, like I said, the flexibility is just there. You work as hard as you want to work, and I've always said, don't let your job, your career work you. You work your career. And a lot of people would say, oh, Angela, she chasing a bag, and she, like, what we out here doing? If you ain't chasing a bag, then you in the way, because we all is chasing a bag. We all need to be chasing a bag. We all should be, setting ourselves up where we can do what we want to do, and also take care of our family and make sure our family is straight, and also saving for retirement. You gotta be at the bag, period. So yeah, when I did work for companies, big companies or whatnot, it was about who got the fattest bag. Because if I'm gonna work for you, you got to be paying something. And if you ain't, then deuces. I gotta be dealing with all that disrespectful stuff, all the drama, all the female and male unnecessary drama. No, I wasn't doing that. I was tired of it. So, no, I wasn't going to stay in RN and work overtime. And, that just was not my goal. More power to the people who don't care and will do that. But that just wasn't my goal. And I'm sorry, I'm just going to say it. That shouldn't be your goal either. Your goal should be to level up, keep leveling up. Why continue being an LPN or RN when you see the nurse practitioners, they not working as hard as y'all, and they making more money? So if you a hustler and you about getting your money, chasing a bag or whatever, and you willing to put in them overtime hours and all that stuff, why work that hard when you don't have to? So continue to elevate yourself so you can work smarter and not harder. I don't be to my feet hurt, my legs hurt and all that stuff. None of that. Thank God. So this job is to let y'all know how sweet this job is. This is a physician's retirement job. We have so many physicians, retired physicians that do this job. We have some physicians that's not retired, but they know that this is the job to have. Like, why am I turning on? Let me see. What the heck? Why am I turning on Flint Street? Where do you have me going? Oh, because they want me to take the back way. All right. So I just had to say that because a lot of people be like, I make that. Like, okay, first of all, I'm not bragging on what I make because I don't. So I did the math. So I could, with this job, the most you can see is 12 people a day. Okay? So if I change from 10 to 12 people a day, say I don't have no cancellations, I got 12 people. So yeah, I could see them, but then I'll be rushing to get my son from school. That's not what I want to do. I want to have some wiggle room. If I get off early and my son's still at SAC aftercare, I can go get my nails done or something. It's okay to have that. I like to have that little downtime before I have to get my son. I don't want to have to rush. So I would never up to 12 to see 12 members. So with that being said, I know the most I can make a year with this company. So I'm going to just say maybe I could do 150 a year, if that. But I'm going to just say close to that or whatever with the bonuses or whatever that they give. So with that, yeah, I'll get about 150. I'll end up making about 150. That's not what I wanna. That's not the max income that I want. Of course, I want more. I'm comfortable with that, but of course, I want more. But do I want to get another job, a different job? I don't. This job is so gravy. I don't want no other job. My time, I'm making this kind of money, and I'm not neglecting my son or missing out on anything. I don't work weekends. I don't work the second job that I was working on Saturday. I don't work that one anymore. So I don't work weekends, and I'm making great money for myself. So I have the autonomy that I want. So I'm not gonna pick up another job. But what I do need to do is figure out how to get more income. So if I can get, if my minimum goal I can set for myself is 50,000. So I'm going to try to come up with something, some merch. I'm just going to try to come up with things where I can get some passive income, because I don't want to work another job. This is all I want to do. As you guys know, I was going to get a luxury car for my, my graduation after psych for my birthday. I was going to get me a luxury car. And then I got with this company, and y'all, I'm still driving a Suburban. I've been driving this since January. The company paying for it. So I don't need a luxury car right now. Why get a car note when I got this big truck? And it's not, oh, you only can drive it to work. I can drive, if I want to go on a road trip, I can drive this truck. So it's my personal and business truck. So why get a car note and just be sitting in the driveway, and I'm only driving it on the weekends? I'll drive this big beautiful Suburban on the weekends and every other day. So that's what I'm choosing to do. So, and then in order to get a rental, you have to be available 3 days out the week, and be available to see 20 members, 20 members a week or whatever, to sum it up. So even if I did start a business, I don't know, I'm gonna still rock this out 3 days out the week, see 20 members a week, just to keep the truck and to keep the little income or whatever until my business get the booming. But so what I'm planning to do is I want to write a book. I've been wanting to write a book about my life. I think my story would be very inspirational. My childhood was horrible. It was like living a horror movie. Literally living a horror movie. So I just want to let people know, females and men, that just because you had a horrible life, a horrible childhood, speaking of mine, most people would think that being a hoe, a prostitute, having a pimp, drinking, doing drugs or alcohol, because you want to get those thoughts out your head. So you think that drinking alcohol and doing drugs is the way out, and you become an alcoholic or drug addict. It's those not the only way. Like
turn left onto West Flint Street.
I used my my childhood as, like, I felt like nobody protected me as a child, and then so therefore I had to protect myself, and to make sure that I was good. So that's why I worked so hard to become where I am, to get where I am today, because my childhood was fucked up. But one thing I did see is the grind. I was around a lot of grinders and a lot of drug addicts. So I could have chose the route to go sell drugs, sell dope or whatever, but that wasn't the route. But when you see somebody hustling, you got to know it's more ways to hustle. It ain't just one way. So just because they was hustling dope and weed or whatever, you know, I was I wanted money too. I've seen them get money, you know, adults, but I was a little kid. I can't get money or whatever. So I used to do whatever. I used to freaking, like, 10 years old, going around Detroit. That was so dangerous. I would dare have a little girl going around shoveling snow, raking leaves. I wouldn't come in the house till my hands was damn near, or and feet was damn near frostbit, because I wanted to make as much money as I can before it got dark. I was gonna keep going. I used to sell candy. You had to be 16. I was like 11 or 12. I lied and said I was 16. And I was going door to door selling candy. And you know, I just was hustling. Like, I want to make some money. And I want to get out of this fucking nightmare that I'm living in or whatever. This shit gots to get better. So finally got out of that. But I just got a story. You just be feeling like fuck everybody, fuck your parents, nobody fucking protected you, was there, and you just, that's why people choose to do the wrong things. But I chose
In 1,000 feet at the
to
traffic
be
circle,
successful.
take the first exit onto Orion Road.
So anyway, so I want to do a book and talk about my story, tell my story. I want to do some merch. I want to do a couple ebooks. It's just things that I'm going to do versus getting another job to supplement that income. I'm not going to do that. So that's that. So back to these health risk assessments that I do. So a couple people I referred or whatnot, they looked at the training videos or whatever, and they have like anxiety, thinking like, no, I can't do this. I'm going to do televisits, blah, blah, blah. And I was like that my first week. I don't know if y'all would remember, but my first week with this job, I was like, oh no, this ain't going to work out. My first visit, I was in their house for an hour and 45 minutes, and the visit was only supposed to take an hour. For each visit, it's only supposed to take an hour. Now it only take me 30 minutes to do a visit. But I was ready to I'm like, this ain't gonna work. I'm gonna try it out, continue do it, because I'm the type, I'm never gonna quit a job unless I have another job that I'm about to start. So I'm like, I gotta hang in here, blah, blah, blah. So I'm glad I hung in there and I figured it out. So I have some people with the same anxiety or whatnot. A lot of you guys are not in my area, so I could train you. But Southwest be having some cheap flights. So if you wanna fly down here, I don't mind, if I refer you or whatever and you come on board, I would train you. I trained one of my friends and that I referred, and day one she was done with her visit before me. I was like, what is you doing different? And she was like, I'm doing exactly what you told me to do or whatever. Like, she was getting her visits done. I was still taking an hour. She was getting her visits done in 45 minutes. Probably because I'm on a road where it was all woods and they build houses. So let me know if it's still buffering. I'm almost out of this.
Right North Rochester Road.
And on a regular road. So it shouldn't be buffering anymore. So I should be out of buffering now. Okay.
At the light, turn right onto North Rochester Road.
Something on there. Oh, Lordy. All right. Am I still buffering?
At the light, use the second from the left lane to turn left onto East Yankin Road, then turn right.
I shouldn't be buffering anymore because now I'm in a city. I'm out the country woods. Is this where I'm going? Yep, I'm here.
Turn right, then turn
The
left.
brunch bar. I will be going to the brunch bar after. I think, oh, they close at 3. Excuse me. What time does they close? Do they close? 3 o'clock. Thank you. Damn it, they close at 3 o'clock.
Head south.
Okay. Yeah, I'm good. So, what was the last thing that y'all heard me talk about? Because I was just talking and talking once again, and didn't know that I wasn't connected. So let me know. Oh, VO Spa right here. Customer parking only. What customer? Nectar juice. Okay, maybe I don't want to get a. Somebody put in the chat in a couple words what I was talking about last. Because I don't want to say. Okay, hold on. All right, let me back in, because with this big ass truck, y'all, I tried to pull in. I didn't know you can't pull in between 2 cars in this truck. And I hit somebody car, but I don't think I did no damage, but I got a little scratch on this one. And I was going to the airport in a hurry. Okay, so all right, you train your friend. What? Oh my God, that was last thing y'all heard was I trained her and it only took her 45 minutes. Jesus Christ. Oh, what was I saying after that? So she was getting done faster than me. And I talked about, okay, so I was saying that when you tell them what areas you want to work, what counties, if you're on the border of any other states, what states you're willing to travel to. So your first visit is going to always be the furthest visit from your home. Everything else is going to be in that same area. So 1 minute away, 2 minutes, 5 minutes, no more than 15 minutes, and that's pushing it. Okay, so you don't have to worry about driving all over the place. It's going to be in that same area. Like if I go to Flint, then my longest visit, the drive time from my home is going to be 45 minutes, 50 minutes, but all my other visits are going to be in that same area. So that's that. And just so y'all know, I got a new headband. So I've been rocking this. I love it. When your edges toe up, throw the headband on. But anyway, so yeah, you're not going to be driving all over the place. You're going to be in that same area. And I was just talking about this job, like they give you the 45 minutes. I mean, when you first start, they give you the 90 minutes because they want you to succeed. So, so they all can get paid. The recruiter, everybody else can, everybody get, you make money, the company make money, everybody. And that's when I was saying, maybe I need to be looking into how to start a health risk assessment company, because baby, they must be making some money. I've been driving this truck since January, and this ain't cheap. And for the referral bonus, they not paying like no $200, $100. They paying a hefty $1,000 per referral. And I was saying, don't think that I'm sure most of y'all know I'm not trying to say, hey, come on board so I can get the $100,000 referral bonus. Of course, I want the $1,000 referral bonus, but this is what I've been doing. If I find something good, I'm telling y'all about it. This time I'm just getting rewarded for it. So that's that. What else did I want to talk about? So that's that. The podcast I put on hold. So I think I'm going to focus on my book, some merch, and dropping those recorded videos on Wednesdays. It's just going to be me laid back, kicking it, just talking, just different topics. Something like a podcast, but not a podcast. And just figuring out what I could do just to make some passive income, because this is it. Health risk assessments. And I ain't gonna lie, I have been an employee that, when I say let work your job or your career, don't let it work you, I mean it. And I'm not sad to say, I find something. First of all, we're gonna be working for years and years and years and years. Why do you wanna be a Cena for the rest of your life? Lifting people, changing diapers, running around, getting leg pain, foot pain, back pain. That's hard work. That's hard work. A floor nurse, that's hard work. Somebody got to do it. So that's that. Somebody got to do it. But let's elevate. Let's keep going. Let's keep going. So I don't really look for easy jobs, but I look for jobs that is going to make sense with my life, align with my life. After you climb this ladder and you work so hard, you just feel like, I ain't supposed to be working that hard. I already did that. I paid my dues. I paid my dues as a caregiver, running around there, changing diapers, getting shit on my wrists, and I did all that. Lifting people, hurting my back. I did it. I already paid my respect to these jobs, and worked my ass off, and sacrificed a whole lot. When I say sacrificed a whole lot and put in the work, I worked so hard to get where I am today. That's why I haven't enrolled in the freaking DNP program yet. I worked so hard. I was like, look, passing medications. You didn't put 20 pills in a cup, and you got the patient sitting there taking them one by one and asking you, what's this? Now, one thing I did learn from LPN school, my teacher tried to tell us, like, once you get on that floor, what each pill you pass and what is it for. You just Google it. No, any pill and I'm gonna give y'all the same advice too. When you passing medication, know what it is. If you got time on your break to look up side effects, it's the common medications. What medications we passing? Synthroid, carbidopa, levodopa, omeprazole, sertraline, Lyrica, gabapentin, uh, what else common drugs? Like it's only a few common drugs you gonna be passing in a nursing home or whatever. Hospital could be different. I've never worked at the hospital. But um what is that? So you the take some time and know why you pass it. What I mean, the name of the drug, what it's for, and the side effects. Because I'm going to tell you, it's going to help you in the long run. When you get to NP prescribing medications, you got to know all that stuff. So if you start now teaching yourself what each drug is for, the side effects, you're going to be so gravy when you get in the NP program. You going to know that stuff. So that's one of my recommendations, that I wish I would have listened to my LPN teacher. But let's go back. You going in there and they taking one at a time. What's this for? And you just sit there like, just take your pills. Well, what's this with? And you be like, give me the pills. I'll be back. You gotta go and say what each pill is, and come back like different cups. Like, this is your blood pressure medicine, this is your acid reflux medicine, this is your medication for your mood. Like that, and you got 30 other people to pass to. Like, that used to be my pet peeve. And then the seniors don't want to do the treatments. Yeah, and so you gotta be a good nurse and go do a treatment when you got all these medication to pass. Oh, let me put this calzone on you and all this. Like, it's like, I got so tired of that. Listen, if you love it, you love it. If you want to stay there, stay there. Me personally got tired of it. And I'm like, no. And I just seen how everybody with higher levels, positions, they wasn't doing that much. I'm like, what the fuck? They getting paid more than me and they ain't doing what I'm doing? Come on now. So just level up. If you work that, I know some seniors, I be like, girl, why is you still a senior? Why? Girl, when I was an LPN, I was like, girl, you would be able to walk, what they say, miles around me. Like, girl, boy, level up. People be scared of those exams and NCLEXs and stuff. Like, don't be scared, man. You fail, you keep taking it until you pass. Eventually, one day you gonna pass. But I just want to motivate people to level up, because it's money to be made. That's why I don't care about what nobody else making. People don't care. Don't worry about what nobody else making. They making it, you can reach it too. Anything is obtainable if you reach for it, if you work for it. So I be seeing people getting depressed. Oh, such and such makes. So what? You can too. Such and such put in the work. I had a few friends that I'm no longer friends with. Like, I can't believe I'm not friends with these people because of jealousy or expecting me to take care of them. That's why, I don't care about saying what I make or whatever. What I make is what I make. Don't ever think because of what I make, I'm supposed to be doing something for you. Because no, baby. I'm saving for retirement. I'm traveling. I'm throwing ridiculous birthday parties for my son. I'm spending my money how I want to spend my money, not how you think I should spend my money. And I'm not spending it on you, because why? Now, if you need it, if we in a situation where you need something, yeah, I got you. I might, if I know you can't pay me back, I might be like, don't worry about it or whatever. But if you got the same physical ability as I have, especially people with no kids or grown kids, I had Aiden on one breast while I was typing up Capella papers. Y'all seen me. Y'all know how I was doing it. The people from on here from when I was doing Excelsior. Aiden been in the videos all the way back then. So ain't no excuse. I did it with a freaking newborn. And it was easier then. Now he a toddler. And so I did it. Ain't no excuse. That's what I be like. I'm not taking care of no friends. Every friend that I got, the friends that I cut off or cut me off, I swear on everything. Y'all know I won't be doing this YouTube trying to motivate strangers and not do it for my own friends and family. They just didn't want it. They didn't want it. They wanted me to do it. And then be able to call me, work their jobs, and then be able to call me and ask me to borrow money like I'm a bank and pay me back. And some of them will pay me back. But you're not going to do that. You're not going to play me like a bank. You're not going to elevate yourself, stay in your position, and then call for me, use me like a bank, me to borrow money, and then you pay me back. No, that's not how that works, boo-boo. I'm not doing that. And I'm definitely not taking care of you when I see you not doing nothing and you got the same ability. Your situation is better than mine because you have no kids or your kids are grown. Like, come on. Nah. I'm about to go in here and get this facial. Thanks for rocking with me. Expect some content Wednesday for sure. I have to wait until I get a volunteer, somebody that can do the health risk assessment video with me. But I got y'all. Thank you guys for tuning in. Sorry for all the technical difficulties today, but on this live, it's just making like my skin is glowing. Like, you need a facial for what? But if y'all can see the little black marks. I don't know, like somebody, yeah, them pores too big for me. We got to get this taken care of, and hopefully they can do what they supposed to do, because like I said, this is the wrong freaking spa. But anyway, I love you guys. I love that you guys support me. I love dropping gems for you guys. And like I said, now that I don't have that Saturday job no more, and I have Saturdays and Sundays, we good. Y'all see more of me. Thank you guys. Thank you. Y'all want to see the spa that I'm going to. I'm sure they got water in there, so. Can y'all believe all those trolls that was on here earlier? That was crazy. I've never seen anything like that. Oh, check the shoes. Let me show y'all my shoes. So comfortable. Make sure y'all invest into some nice, comfortable shoes. These shoes are so comfy and cute. But this is the spa. Oh, that is the spa. And I am looking forward. It looks beautiful. Hello. Fine, I'm Angela. I'm just showing my YouTuber friends this. Oh, it's beautiful. Beautiful.
And you have a consultation today, Angela?
I do.
Awesome. I just have a consent form for you to fill out.
All right, guys. I will talk to you guys later. And thanks for tuning in. Bye.